Anterior cervical discectomy fusion is truly a minimally invasive procedure. It starts with a small incision along the front of the spine. We move the muscles out of the way, including the swallowing tube known as the esophagus and the breathing tube known as the trachea. After that, we can look at the spine and we can remove the offending disc that's pushing on the nerve and the spinal cord. This is done with use of an operating microscope so that we can prevent injury to the spine. This results in relief of the pain in the neck, and the pain radiates into the arm and the shoulder region and the hand. Once the disc has been removed, something has to be put in its place. We often use something called a cage, which is a piece of plastic that's filled with either your own bone, cadaver bone, or artificial bone. We then apply a small plate that helps stabilize the prosthesis in place. This is an example of a patient that has had an anterior cervical discectomy and fusion procedure. This is the front of the spine, and this is the back of the spine. These are the bones, and these blank areas are the discs. As you can see, this disc has been removed. This is a cage, which is filled with cadaver bone. These are tiny plates that help hold the prosthesis in place. With this type of procedure, most patients complain about a little bit of discomfort for a few days with swallowing, a little hoarseness of their voice. They often transition back to work and activity quite quickly. This type of procedure leads to hospitalization for an overnight stay.